Welcome to Forum 360 with its global outlook and local view. I'm Ardith Keck, and today we're talking about an organization in Akron that helps people who are addicted to something. If you have a substance abuse problem and you don't know all about them, CHC Addiction Services. If you don't know all about them, please pay attention. Liz Crutchley, PLCC-S, who is Director of Medically Assisted Treatment, is here with me to answer questions. Thank you for joining us, Liz. Please tell us about the mission of CHC and what does CHC stand for?
Gladly. CHC's mission is to treat, inspire, support, and empower individuals and families who've been affected by the disease of addiction. Our goal is to help those folks reduce the stigma of seeking addiction and mental health treatment, and then help them in their progress towards recovery.
And CHC stands for?
It stands for Community Health Center, and we've since expanded that name to let people know that we provide addiction services specifically.
Okay. And your job is Director of Medically Assisted Treatment. Can you tell me what you do?
Sure. I supervise a team of clinicians who work with patients who have opioid use disorder, in addition to perhaps other addictions or other mental health disorders. Our patients require medication-assisted treatment, so they would be receiving a type of medication that's going to help them stabilize their opioid use disorder and help them advance towards recovery. Okay.
Medically assisted treatment, you abbreviate to MAT.
We do.
M-A-T. Why is it an important tool for recovery?
Well, when you are trying to recover from any addiction, it's a particular challenge. That involves your brain chemistry, it involves your lifestyle, it involves your mental and emotional health. And so, as many other diseases are treated, a medication might be involved. For opioid use disorders, the brain chemistry requires a bit of a reset. There may be a deficit in terms of producing certain chemicals, and the medication is going to help a person stabilize those needs and reduce their physical symptoms of withdrawal, which tend to be the most problematic presentation when trying to enter recovery. If you're feeling sick every day, it may make it really hard to pull off that goal that you have for achieving recovery. It's going to feel out of reach without a medication to support you.
How many staff are there in CHC?
Well, across administrative, physical facilities, clinical, and medical staff, we have about 140 people.
And do all your patients receive basic health care in addition to addiction services?
It depends on what the need is. We don't have a primary care type of situation set up for all patients. However, if there's a need that arose and they needed to be seen by the doctor, we do try to accommodate. At our main campus, we have a medical director available, and if the patient is on medically assisted treatment, they have even greater access because they're there for the medication services.
Mm-hmm. How do you handle all addictions, like smoking, for instance?
We do, yes, and it depends on a person's level of motivation, what they're ready to treat, but we do assess and treat all types of addictions.
Is it true that a lot of people who are addicted to something also smoke?
Yes, that is true, yes, and there's an even higher rate of success if you eliminate all other addictive behaviors at the same time. So you might be focused on quitting your opiate use, but if you also have a tobacco use disorder, you would want to try and enter recovery on both of those things at the same time. It's a particular challenge, though, for people.
Mm-hmm. I'm sure. If you could get more resources What services would you add?
Well, we would like to expand on the services that we have. There is always a need to serve the community and offer them supportive, comprehensive wraparound care. So elements that we're trying to increase would be community case managers, peer recovery supporters, increased psychiatry access, and also supportive housing, which we do offer, but are always in the market to expand.
How large is your patient population?
We serve about 1,100 patients, and about half of those are enrolled in medically assisted treatment.
And do you believe that there are lots more people out there who need your services but are not enrolled?
Absolutely. In Ohio, about 1 in 4 adults is affected by the disease of addiction. Approximately 20% are affected by a mental health illness. And with the pandemic as well, it's normal to estimate that those numbers are probably increasing. So in Summit County alone, that's us serving over 1,000 patients, but probably about 350,000 people in need in Summit County.
And of those you have?
We have 1,100 patients approximately.
Wow. Mm-hmm. So there are lots more out there.
Yes. Oh, I misspoke to that one point. That in Summit County, the number would actually be 135,000 people out of our total population who would need to access addiction or mental health treatment.
So, small percentage. How has the pandemic affected your patients?
It's made treatment even more necessary. A lot of patients with either new or established recovery, they lost their access to supports they had in the community. 12-step meetings, they got reduced in frequency, or they shifted to platforms like Zoom, which if you're not very skilled at navigating the internet might make it more difficult to have your regular supports. And then just the distance that grew between people by staying home more, or having social distancing measures. So having a formalized treatment option where we could control for some basic safety precautions and keep people healthy throughout the pandemic, it really emphasized how important what we do is.
Okay. Lots of people quietly manage their addiction, substance use, so to speak, but the stress of the pandemic took it to a different level. So what should people do if they are experiencing a major problem?
Okay. The best thing they could do is, speak to a loved one first and see if there is someone in their family or in their, friend group who understands what addiction is like. The first thing you can do is lower that stigma that you have about it. Most people know somebody who either has an addiction or is in recovery. That's not hard to find anymore. And so by developing that relationship and getting yourself ready for treatment, they may have some suggestions for you on how to go about getting it. For us, our emphasis is on having as quick access to treatment once a person's ready. We like to make sure that they can get in within 24 hours if needed.
Do you partner with other agencies in the community?
We do. We partner with many local agencies, including area hospitals. We have relationships set up with a program like First Step at Summa Hospital, where a person might attend for detox services and then continue on medication-assisted treatment and be referred to us for ongoing care. In addition to that, there could be referrals from children's services, from court programs, from probation programs, and even other mental health and addiction treatment referrals.
I was interested in preparing this to see that you also partner with ODOT.
Oh, yes. Yes, so we're providing addiction treatment services to help with any kind of traffic violations that would have a person needing treatment related to addiction.
And drug screening.
Yes.
Which would be very valuable with the
yes.
Department of Transportation. Is Oriana House one of those that you work with?
Yes, we have a lot of different patient status who are also engaged in Oriana House, and that could be related to their probation. It could be that we're an expansion of some of the services they already receive, and we work in partnership with them.
And can you give our audience an idea of what Oriana House is?
Well, they may be best to describe that, but they do offer varied residential, outpatient, addiction treatment programming, in addition to some corrections type programming.
Right. They sometimes are the courts
Yes.
mandate Oriana House. Okay, where are you located?
We're located at 725 East Market Street in Akron, Ohio. We're very close to the University of Akron campus as well as Summa Hospital.
Okay. We're talking today about CHC services. And since this is Addiction Services, with me is the Director of Medically Assisted Treatment, and that is Liz Crutchley, with all kinds of initials after her name. She is the one who takes care of people who need treatment, and that is a very important part of their. How do people contact you?
They can contact us in many different ways. They could find us on the internet at chcaddictionservices.org. They could call our main operations line at 330-434-4141, or they could come in during normal business hours and complete a walk-in appointment.
Now, when they come, what happens?
When they come, they might need a few things. They may need a driver's license. They may need an insurance card. They may need a proof of their residence. If they don't have those things, we do have community support workers or recovery coaches to help them obtain those documents so that they can get into treatment.
Okay. And do you have residential treatment programs for people who need it?
We do. We have all levels of care, similar to how there may be levels of care if you were participating in medical treatment. It would be the same for addiction. So we have outpatient programs that stretch across several departments, and then further up we may have intensive outpatient. We have partial hospitalization with supportive housing, and then we also have residential treatment.
I have RAMAR as one of those programs. What is that?
RAMAR is the Rocco Antonucci Memorial Treatment Program. And so it treats men in a residential center. Patients are there for approximately 45 to 90 days and are able to step down into aftercare programming to help them continue on their journey towards recovery.
And what is Touchstone?
Touchstone is our women's program. It functions similarly to a residential treatment program. However, it has some special accommodations for women and children. So it is supportive housing, and women are able to take their children provided that they're under the age of 5 or they're not, enrolled in school. And the children are able to live with them. So they are having some daycare option while participating in treatment services, or there may be even certain groups that support the women and help them learn, positive interactions with their children.
Is MOMAT, M-O-M-A-T, your program?
MOMAT is not my program in particular. However, it stands for Mothers on Medically Assisted Treatment, and that is run primarily by the Touchstone program. So they help them in that unique situation of being either a new mother or a recent pregnant mother who is also on medically assisted treatment. They have specific case management and recovery supports that help them attend their doctor's appointments, make sure the health of their baby is in good progress, and that they understand how the medication is going to help them have a healthy pregnancy and then a prolonged recovery period.
Okay. What happens during outpatient programs exactly?
Oh, a lot. It's tough to answer that question because so much can occur. But outpatient programming at its foundation is to help a person learn how to recover in real time. they're living in their own home, or perhaps they're seeking a new housing because where they were living previously wasn't conducive to recovery. And so it's taking a person through all those hurdles and challenges and supporting them. It may involve case management so that someone is working with them in the community. It may involve a recovery coach so that they're on top of their daily goals. But overall, the goal is to maintain that long-term abstinence in their own living environment and with perhaps their original or some new supports.
I guess I wonder, do you consider this a disease, or do you consider it something that people shouldn't do and therefore they're bad?
Well, I have strong opinions about that. We definitely fall under the disease model of addiction. Other people may refer to things like choice theory, where a person might choose to use drugs or alcohol. But that really strips a person of what happens to them after a disease has progressed, and it might move from choice to more automatic thoughts, the specific need to try and cope. And the measure may be harmful. They may be consuming a substance that could hurt them. However, that person might have lost the ability to cope appropriately without alcohol or drugs. So they're having to learn new skills. Particularly during the pandemic, we've seen a lot of American adults abuse alcohol more and more. And that may be because they are not able to cope as well as they used to. So it's important to think of addiction as a disease and not just a choice. Because again, once any kind of withdrawal symptom is involved as well, it's not so much choice, but a matter of trying to feel normal each day. And that's when the medication and therapy becomes vital.
Well, certainly the pandemic has thrown us all. It's not normal, and life has become much more difficult. So I can certainly understand. Do you treat kids?
We do not treat children at this time. Our hope is to also expand and have adolescent programming again. We have had that previously, and continue to strengthen the treatment for adolescents. We do have a prevention program, though, which engages students in the middle school and high school level, and it helps them develop supportive peers who are not just pro-recovery, but really abstinence at that stage, because that is the model for preventing the disease of addiction.
Do you work with schools?
We do. So our outreach programs that work with middle schoolers and high schools, they go directly to the schools to run those peer-to-peer groups.
And you have what is called, one of your prevention programs is Youth to Youth. I thought that was interesting.
Yes, yep. So that is the name for our program that goes out into the schools.
And what do the kids do?
They participate in activities throughout the year. They run summer camps. They have peer-to-peer mentoring and a lot of educational pieces that help them stay strong in their thoughts and desires for remaining abstinent as they get older.
And one youth helps another?
Yes, so the ones that are more advanced in the Youth to Youth program are going to then coach the younger ones and help them through it.
Sounds very good. Opiates is one area that you work against. Is the opiate situation changed? Is it any different, getting better?
Well, I can't estimate whether or not there's been a reduction in opioid use disorders. What I can say is that it has been a reduction in overdose deaths, and that is a really important piece for medically assisted treatment. We have an 85% success rate with patients on MAT obtaining long-term recovery, and that's an incredible statistic. And it's something that if a person is struggling with opioid use disorder, they should know because there are treatment modalities out there that are incredibly successful, and they shouldn't have to feel alone.
What do you use volunteers?
We do use some volunteers. It depends on what the ask is or the need. We've had people come in to help beautify different kinds of facilities that we have. We have also had a relationship with the 12-step community in terms of running meetings on site and things like that.
what kinds of statements do your recovered patients make about you?
There's just a lot of gratitude. And that's a hallmark of recovery in general. But we find that most patients are very grateful for, not just us having a hand in their progress towards recovery, but the fact that they've achieved it, the relief that comes with that, the enjoyment of life that comes with long-term recovery, and that things are moving much easier for them. We have a lot of staff members even who return to us after years of having help from us, who then seek important roles in our staff and in our community at CHC.
I certainly give credit to anyone who is recovered because it's difficult, very difficult. What are some of the signs that someone needs help?
Well, signs that a person needs help are going to be largely behavioral. You may notice changes in their demeanor, their personality, similar to a mental health disorder. You may find that there is increased isolation. You might notice changes in their ability to look well on a day-to-day basis. That might become less consistent. And really, the isolating and the retreating from others is a common behavior in addiction because it invokes a lot of shame for people. And if they are actively using, they may be trying to hide that.
And if it's okay to seek help?
Absolutely. Yes, that's the only way to get out of it, is to then lift that veil of shame and understand that there is plenty of resources and support and empowerment available to people. It's a huge undertaking, but it's worthwhile.
And if you are a loved one or someone, a friend perhaps, of someone who needs help, how do you get it for them?
The person's going to have to want it, but you can certainly encourage them all along the way. And if you notice those changes in behavior, it is helpful to not ignore it and to try and gently and supportively encourage them or ask them about what's different, what's changed. They may be able to describe how they've been feeling recently and open that door.
Do they generally need pushing?
In some instances, yes. Although, with addiction, sometimes other life consequences may show up. You could have a loss of driver's license, or maybe, sometimes new legal charges are involved. There are those external motivators that might push people into treatment a little faster.
And they call you?
Yes, absolutely. They could call. They could look us up on our website, which has plenty of as needed treatment information, or just simply walk in during business hours.
Do you sometimes have courts who say this person needs treatment?
Yes, yeah, we do have courts that will mandate or recommend treatment.
Okay. And let's talk again about where you're located.
Yes, 725 East Market Street in downtown Akron, near Summa Hospital and the University of Akron.
And people can contact you by your website?
Yes. Website, chcaddictionservices.org, by phone, 330-434-4141, or in person.
All right. And the Youth to Youth program, I was intrigued by that because it sounds as though the recovered person or the person who is working with you can talk to the student, and maybe they have a family member who needs help.
Yes, that could be. There's a lot of different scenarios for why the students are interested in being involved in the program. They may already be aware of a family member who's needed help and that's impacted them. But it's that mentorship and those strong relationships that help the students continue helping each other and staying in abstinence as they get older.
So the basic way to get help for someone is, if they want it, they have to want it first. And if they want it, then the call can be made to CHC Addiction Services.
Absolutely.
And you're not going to blame them
No.
You're going to consider it a disease, which it is, and try to help them.
Absolutely.
All right. This is what CHC stands for, Community
Health Center, yes.
Okay, and you changed that recently?
Yes, we recently, downsized the Community Health Center statement and then added that we're an addiction services program, so that it's clear to anybody who's coming to us what kind of help they'll be receiving.
Okay. And with the pandemic, things may have gotten worse for people, but they should know that you're out there ready to help.
Absolutely.
Thank you, Liz Crutchley, for coming today and talking about the mission of CHC Addiction Services and how you can help people. And I appreciate your wise advice.
Thank you. Pleasure to be here.
Thank you.
Forum 360 is brought to you by John S. and James L. Knight Foundation, the Akron Community Foundation, Hudson Community Television, the Rubber City Radio Group, Shaw Jewish Community Center of Akron, Blue Green, Electric Impulse Communications, and Forum 360 supporters.